We continue with our discussion on women's health. In late Qing dynasty, Dr. Fu Qingju, in his Fu Qingju's Gynecology, states, women may continuously experience a white discharge throughout the year, similar to mucus or saliva, which is uncontrollable and sometimes foul-smelling, known as leukorrhea. Leukorrhea is due to excessive dampness and deficient fire, liver depression, and weak qi, leading to spleen damage. The damp earth qi sinks, causing spleen essence to fail to transform and nourish the blood into menstrual fluid, instead turning into a white slippery substance that flows directly out of the vagina. The treatment should primarily strengthen the qi of the spleen and stomach, with a secondary focus on soothing the liver, ensuring that the wood element does not block the earth element. This allows the earth qi to ascend to heaven, strengthening the spleen qi and dissipating dampness, thus resolving the issue of leukorrhea. Fu Qingzu also discusses other types of discharges, such as green, yellow, black, and red discharges and their respective treatments. The Essential Prescriptions from the Golden Cabinet states that if a woman presents a calm and disease-free pulse, but with a slightly weak radial pulse, thirst, lack of appetite, and no chills or fever, this indicates pregnancy. These symptoms are expected to appear around 60 days into the pregnancy. Guiji Tang, or cinnamon twig decoction, should be used in such cases. It also mentions that if a woman, after being affected by an external pathogenic wind for 7 or 8 days, experiences a recurrence of chills and fever at regular intervals, and her menstruation suddenly stops during this time, this indicates that wind heat has invaded the blood chamber, combining with the blood, thus causing periodic episodes like malaria. Xiao Chai Hu Tang, or minor bupleurum decoction, should be used for treatment. In Eastern culture, there is a practice for new mothers known as sitting the month. The Tang Dynasty physician Zan Yin placed great emphasis on the regulation of qi and blood in postpartum women. In his book Chan Bao, particularly in the chapter General Discussion on Postpartum, he specifically recommended taking Sheng Hua Tang, formula made from Ligusticum wallacei, angelica, dried ginger, licorice, and peach kernel, mixed with wine, stating postpartum stagnant blood should be dispelled and new blood should be generated. This formula, which promotes transformation and generation, is truly a divine medicine for after childbirth. The key to differential diagnosis in gynecological diseases lies in analyzing the clinical characteristics of menstruation, leukorrhea, pregnancy, and childbirth, along with overall symptoms, tongue appearance, and pulse condition. This is done according to the principles of yin and yang, exterior and interior, cold and heat, deficiency and excess. Therefore, a comprehensive and holistic analysis, from local to overall conditions, is essential in differential diagnosis of gynecological diseases to determine the nature of the disorder in the organs, qi, and blood. This aids in making an accurate diagnosis and provides a reliable basis for treatment. Since women's physiology is often affected by blood, leading to a predominance of qi and emotional volatility, this often affects the liver. Imbalanced diet, worry, fatigue, and overthinking can harm the spleen and stomach. Factors such as insufficient innate constitution, early marriage, frequent childbirth, and excessive sexual activity can damage kidney qi. Hence, gynecological diseases often result from dysfunction in organ functions and imbalances in qi and blood, leading to damage in the Chong and Ren meridians. The common treatment principles include nourishing the kidney and yin, soothing the liver and nurturing the liver, strengthening the spleen and stomach, and regulating qi and blood. These are the basic principles in the treatment of gynecological diseases.